Medical emergencies on board a vessel can be very serious and should be treated with the same kind of emergency response as any other situation. 4 of the most likely medical emergencies you may encounter on board a vessel include opioid overdoses, alcohol overdoses, severe allergic reactions, heart attacks. You must inform the captain immediately if you suspect anyone on board is having a medical emergency. The captain is the only one who can make the decision to turn the vessel around, and he or she will also have access to radio equipment if they need to summon any additional help. In addition to this, no one on board should ever call 911 from their personal phones, as this will only result in delaying the whole process. As with all other emergency situations, everything must go through the captain and they will decide what the best course of action is from there. Opioid overdoses can be extremely dangerous as they can suppress the breathing center in a person's brain, causing their breathing to slow down to a dangerous level or to even stop completely. Not everyone will present the exact same signs of symptoms, but some of the bigger signs to be wary of include unresponsiveness even with vigorous shaking, slow and irregular breathing, no breathing, constricted pupils, dark blue undertone on the fingernails, lips, and inside of the mouth, slow heartbeat or low blood pressure. If you suspect that someone is suffering from an opioid overdose, you must immediately inform the captain, administer Narcan or naloxone, monitor the individual, and perform CPR if necessary for 5 minutes. Give a second dose of Narcan or naloxone if there is no response. Continue with rescue breathing or CPR. Narcan is an injectable that is administered through the nasal cavity. It is very quickly absorbed through the nasal membranes inside the nasal cavity and will get into the bloodstream almost immediately. Naloxone hydrochloride is exactly the same chemical as Narcan, but is administered into the shoulder or hip via a syringe. They are both equally effective, so you may administer whichever one you feel more confident or comfortable with. It is also important to note that there are no negative side effects to administering naloxone or Narcan to someone who is not having an opioid overdose. So if you suspect an overdose has taken place, err on the side of caution and administer the medicine. Alcohol overdoses are much more common than other medical situations and more often than not can be handled without needing to turn the vessel around or seek any additional medical attention. Signs and symptoms of alcohol overdoses include vomiting, mental confusion, stupor or unresponsiveness, seizures, slow or irregular breathing, dilated pupils, hypothermia. If you suspect that someone is suffering from an alcohol overdose, you must immediately inform the captain, turn them on their side in the recovery position, cover them with a blanket, treat them for shock, monitor their airways to ensure they don't choke on their vomit. Do not give them any fluids or anything else by mouth. The third medical emergency you may encounter on board a vessel is a severe allergic reaction. Most people who have known food allergies will have their own medication with them, most often in the form of an EpiPen. The 2 primary symptoms of an allergic reaction are coughing, wheezing, and difficulty breathing, often accompanied by itchiness in the throat or mouth and difficulty swallowing. Itchiness, hives, or redness of the skin in combination with swelling around the lips or around the eyes. Other possible symptoms include nausea, vomiting, abdominal pain, and diarrhea, dizziness and lightheadedness, heart palpitations and chest discomfort or tightness, mental confusion, weakness, low blood pressure, rapid pulse, loss of consciousness or fainting. As with an opioid overdose, not everyone will present every sign or symptom. However, if the 2 primary symptoms are observed, the individual is most likely suffering from a severe allergic reaction. If you suspect that someone is suffering from a severe allergic reaction, you must immediately inform the captain, help the individual prepare their EpiPen or administer it for them if they are incapable and have given you consent. If the individual is unconscious, consent is implied. If you are required to administer it for them, follow the following steps. Hold the pen so the blue tip is facing up and the orange toward the individual. A good way to remember this is blue to the sky, orange to the thigh. Pull out the blue safety pin, jab the orange end into the lateral thigh until you hear it click. Hold the pen in place for 10 seconds so the medication can be administered. After 10 seconds, remove the pen and the guard will automatically cover the needle so it will not pose a risk to anyone else. The medication from the EpiPen will last approximately 45 minutes before the epinephrine is metabolized and the allergic reaction may start up again. After this, the individual must be treated in a hospital. This is why it is absolutely crucial that you inform the captain immediately so he or she can turn the boat back to the harbor to get the individual proper medical attention as soon as possible. Another important thing is to make sure that the medication is actually going into the person's skin and not being blocked by anything. The pen is capable of going through clothing just fine, but be wary of anything in their pocket such as a phone or wallet. Heart attacks can strike anyone at any time, including on board a vessel out in the water. The classic signs and symptoms of a heart attack include chest pain or tightness, an aching sensation that may travel down the arm, neck, jaw, or back. This pain tends to affect females differently from males. Females often describe a softer pain in the back or neck and is sometimes harder to diagnose as a result. Nausea, indigestion, heartburn, and abdominal pain. Shortness of breath. Profuse sweating. Fatigue. Lightheadedness or sudden dizziness. A green-gray color to their skin. If you suspect that someone is suffering from a heart attack, you must immediately inform the captain, procure the gloves, defibrillator, and breathing mask from the bridge. Be prepared to do CPR. A proper response to a medical emergency can mean the difference between life and death for the afflicted individual. It therefore cannot be stressed enough how important it is to inform the captain immediately so he or she can decide what the best course of action is and whether or not the vessel needs to head back to the harbor.